Welcome to CareTalk, your healthy home for incisive debate about healthcare, business, and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
Hey, John, we haven't talked about the Supreme Court in a while, but this week they had a landmark decision about LGBTQ rights. Tell me about it.
Well, it's a win for gay rights, but why are you bringing this up on our show, David?
Well, John, come on, I'm going to find a healthcare angle into it. But, it was surprising that Neil Gorsuch, who is supposed to be such a conservative justice, decided to expand the Civil Rights Act in a way that said homosexual or transgender people cannot be fired for that reason alone from their workplace. So I think it's very important, John, as just impacting the world and the workplace. And the first obvious thing about why it's related to healthcare is that if you have better access to work, better job, higher income, better health.
Yeah, no, I think that's the right answer for us. The reality is that your deaths per 10,000 in a rich community are like 50 per 10,000 people, and in a poor community, it's closer to 90. There is a linear relationship between poverty and wealth and illness and better health. Denying people a job, denying them equal access to a job, discrimination of all sorts, actually has a big impact on healthcare overall. And it's shown across race, gender, sexual orientation. And the more we can stop discriminating, the more likely we are to have better health outcomes.
John, I think it's that's sort of the obvious point as you're saying, and to buttress what you were saying, they say an Urban Institute study that was saying that poor adults are almost 5 times as likely to report being in bad health or fair health compared to people that are on the wealthy side of things. So it's just a huge difference in death and just in satisfaction. But let's get a little wonkier, John, because any kind of discrimination really causes stress with people. That's very much like PTSD, and the negative health effects of that cascade from there.
There's no question. I think I looked at a study the other day of 28 different epidemiological studies that showed the long-term impact of allopathic stress, of the PTSD on the system, actually leads to more inflammation. So there's a tendency for some critics to kind of blame the victim around specific health behaviors that could be a response to stress and depression. But there is also the additional burden that is unquestionable if you look at the epidemiology, the facts, that discrimination hurts people directly. It literally drives inflammation, which leads to cardiovascular disease. And you see it across not just the United States, but all the rest of the world. So when people are marching for justice and marching for opportunity, they're also marching for better health for traditionally discriminated communities, like folks who have a different sexual orientation than the folks who want to discriminate against them. I mean, it's really, what's remarkable is when you go full wonky, it's not that hard. You don't have to go far to see the long-term cost on people's bodies and minds of being discriminated against. And so that's why this Supreme Court decision is really something to celebrate.
John, just to take it a little bit further, this kind of PTSD leads to things like increase of blood pressure and weight gain. It also has some effects on behavioral responses, riskier behaviors, more substance abuse, and then it has an impact on how healthcare is used and whether people have effective access. Now, this ruling is handed down during Pride Month. It's worth noting that not only during Pride Month, but also on the anniversary of the Pulse massacre, the Trump administration issued an order to reverse the anti-discrimination provisions for healthcare services for trans people that's contained in the Affordable Care Act. The Supreme Court ruling doesn't undo that automatically, but it takes a pretty strong stand.
Well, and it's remarkable. It's just another head fake on the part of the White House to say that they are not discriminatory to gay people, and then to start stripping away rights like the opportunity to serve and in our military. I mean, really, to deny trans people who are doing a fine job in uniform the inability to wear it, to strip away the ACA. They don't even like the ACA. It's remarkable they're even paying attention, except to use it as an opportunity to push people back and avoid people getting access to coverage that they sorely need and clearly deserve. Now, it's hopefully the country rising up around issues of discrimination and fairness and equality of opportunity. This will be added to the long list of things that we actually have the ability to change. Other developed countries have changed it. We see opportunity in general growing effectively across the industrialized world. We shouldn't slide back. And I think if we add the healthcare impact, hopefully that'll, David, get people even more focused on issues of discrimination and opportunity as they go into the voting booth this November.
John, there's some real irony here. The Civil Rights Act from 1964, which is what this case was decided on, it added that you can't discriminate against someone based on sex. Now, in rereading this, because I don't remember back in those olden days, as you may, they added sex because at the time, the idea of equality of women seemed even more far-fetched than equality for Black people. And so it was inserted with the idea that that would kill the bill from passing, but it stayed in, and it's actually the basis of this decision now. John, when you talk about what's going to happen at the ballot box, I think it's quite interesting that the Supreme Court, and you can see it with Roberts and Gorsuch, are actually, I think, trying to assert themselves as a healthy part of democracy, even at a time when the executive branch and the legislative branch don't seem to be doing their jobs.
Well, I mean, David, maybe. I mean, I think that anyone who is in any way progressive takes a non-decision or the reassertion of the basic rights that are implied or called out in the Bill of Rights as somehow a win, when really what we've done is we've slowed down the backsliding against opportunity, against women's right to choose, against discrimination against gay and trans people. I mean, I think that we shouldn't mistake a save for a win here. I do think that the Supreme Court's playing a productive role, but it is a very conservative court. And if you look at the long list of other decisions that are being made, they follow a pretty strict constructionist view of the role of the court. And I think there's no question that this administration, plus the combined with the majority of the Republicans in the Senate, have packed the courts with young ideologues. And it's going to be a challenge. I think we're going to have an unbalanced court for a while, and I pray every day that we for the long lives of the remaining liberal justices who, in their time, were actually put on the court as centrists.
Well, John, the good news, I guess, there is that these are higher income people. Maybe we should raise their income so they have a chance of living even longer than they have. I want to end here on a little bit more optimistic note. I think, the Supreme Court in 2015 legalized gay marriage. Anthony Kennedy, retired justice, had written all of the decisions about gay marriage and other related topics. He's gone now. Gorsuch has actually taken it up, and I'm gonna be more positive about that. And I'm not even gonna let you get the last word, except to say, this is David Williams, president of Health Business Group.
This is John Driscoll, the CEO of CareCentrix. Thanks for listening.
Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.